I stared at my half-emptied desk while 30 pairs of eyes burned into my back. The atmosphere on the executive floor crackled with uncomfortable tension as I mechanically placed my belongings into a cardboard box, a small jade plant, my notebooks, a framed photo of my mother. As you may have noticed, Lorelei has chosen to leave our team, announced Gina from Human Resources, her voice artificially bright as she addressed the entire floor. It was her personal decision, which we fully respect and support during this transition. The words hung like poison in the air. Personal decision? I kept my face carefully blank as my stomach knotted. Just 20 minutes earlier, I'd received the termination email with its damning final line. Remove her before she talks about the trial results. What no one realized, I'd already forwarded that entire email thread to Eloise Winters, our largest shareholder, whose father had died waiting for the very cancer treatment our company claimed would revolutionize care. The treatment whose clinical trial data I'd discovered had been manipulated. Vincent, the security guard, hovered uncomfortably close, his instructions clear. No conversations with colleagues, immediate escort from the building, complete departure within 30 minutes. My access badge already showed the red deactivation light. Can I at least say goodbye to my team? I asked quietly. Sorry, protocol for voluntary separations, Vincent mumbled, unable to look me in the eye. Across the floor, my assistant Zoe stared in confusion. Just yesterday, we'd been planning presentations for next month's conference. Now colleagues whispered behind raised hands, faces a mix of shock, pity, and in some cases, poorly disguised relief. My department head, Nolan, watched from his glass-walled corner office, phone pressed against his ear. When our eyes briefly met, he turned away sharply. This same man who'd warned me last week. You're making a catastrophic mistake by pursuing this. He'd been right, but not in the way he'd intended. I placed the last item in the box, my mother's photograph. The bitter irony wasn't lost on me. She'd died from the exact cancer our supposedly groundbreaking drug claimed to treat. The drug that internal data showed barely outperformed existing treatments when you looked at the original, unmanipulated numbers. As Vincent led me toward the elevator, I caught a final glimpse of Gina speaking in hushed tones to our chief medical officer. Their eyes darted toward me, expressions hardening when they noticed my gaze. The elevator doors closed, cutting off the only professional world I'd known for the past 4 years. 30 minutes to erase 4 years, I whispered to myself. My phone buzzed as we reached the lobby. Eloise had viewed my email. Now the waiting game began. Had I just destroyed my career for nothing? Before I continue with what happened next, I want to thank you for listening to my story. If you're feeling the tension building already, please hit that like button. It truly helps these real workplace stories reach more people. If you've ever witnessed corporate wrongdoing and wondered what to do, drop a comment below. Now, let me properly introduce myself and explain how everything unraveled. My name is Lorelei Tanner. Until this morning, I served as senior biostatistician in the clinical research division at one of America's rising biotech companies. We specialized in developing treatments for aggressive cancers, the same kind that took my mother 3 years ago. That personal connection fueled my dedication to joining a company whose mission I believed in, creating affordable, effective treatments for patients with limited options. I wasn't an office troublemaker, quite the opposite. My colleagues described me as methodical, perhaps excessively detail-oriented. My performance reviews consistently highlighted my exceptional thoroughness alongside suggestions to consider broader implications. Nolan once called me brilliantly myopic, seeing details others missed, while sometimes losing sight of bigger objectives. The trouble started during final phase trials of our flagship cancer treatment, BX273. Initial results appeared remarkable. 67% of patients showed tumor reduction within 10 weeks. Our stock price surged. Executive bonuses followed. The atmosphere was electric. Then came my routine quality assessment. I designed these checks myself. Additional verification nobody requested, but that helped me maintain data integrity. Something unusual appeared. Participant numbers didn't align between interim and final reports. 57 patients had disappeared from the analysis. When I raised this with my supervisor, Madeline, she dismissed it. People drop out of trials all the time. They pursue other treatments, move away, lose hope. All 57 within the final 2 weeks? I pressed. Just work with the approved datasets, she replied, sliding a folder across my desk. Medical has already signed off, but these weren't just numbers. They were people fighting for their lives. People like my mother, who tried 3 experimental treatments before the end, each promising breakthrough results that never materialized. After hours, I investigated further. The original data showed BX 273 performing only marginally better than existing treatments, nowhere near the miracle drug our press releases claimed. But the FDA submission painted a different picture, with dramatic effectiveness achieved by removing participants who showed anomalous responses. I approached Nolan with printouts comparing the datasets. These exclusions violate our established protocols, I explained. Look at patient 2257, showed tumor reduction initially, then was completely removed from analysis. Nolan's friendly demeanor vanished. These are complex statistical decisions made by qualified medical personnel. Your role is analysis, not questioning methodology. But our published criteria for exclusion— Lorelei, he interrupted. This treatment could help thousands. Do you want responsibility for delaying that over some paperwork inconsistencies? That night, sleep eluded me. Paperwork inconsistencies? This was data manipulation that could mislead desperate patients while preventing truly effective treatments from being developed. The following week, I discovered a shared drive had been incorrectly configured, giving me access to executive communications never meant for my eyes. There it was, a message thread between Nolan, our chief medical officer, and the CEO. Investor meeting next week. Need stronger efficacy numbers. Phase 3 data, looking mediocre. Options. Statistical refinement possible. Will remove outliers. Make it happen. Too much writing on this approval. My heart hammered as I saved copies to my personal drive. This wasn't accidental error. It was deliberate deception. I followed proper channels despite my growing unease. I met with our compliance officer, Kira, bringing printed evidence and prepared statements. She listened attentively, taking notes. This is very serious, she said finally. I'll need to bring this to leadership immediately. 2 days later, I was called to a closed meeting with the CEO, legal counsel, Nolan, and Kira. I arrived hopeful they would address the issue professionally. Lorelei, began CEO Arthur. Kira shared your concerns. I want to assure you that patient safety is our absolute priority. I relaxed slightly. Perhaps they would do the right thing. However, he continued, what you've identified appears to be a misunderstanding of complex statistical methodologies. Our chief statistician has reviewed the datasets and confirms all exclusions followed standard industry practices. The chief statistician hadn't been included in any of the emails I'd found. I opened my mouth to mention this, but Arthur raised his hand to stop me. More concerning is your unauthorized access of confidential communications and your interpretation of routine business discussions. I felt blood drain from my face. I didn't access anything unauthorized. The drive was shared with the entire analysis team. The legal counsel, a woman I'd never met before, spoke up. Regardless of how you obtained this information, sharing internal communications out of context could constitute a serious breach of your confidentiality agreement. The message was clear. Back down, or else. People are making treatment decisions based on our published results, I said quietly. If those results are manipulated, that's a very serious accusation, Arthur interrupted, voice hardening. One that could damage not only this company, but the hope of thousands of patients counting on this treatment. The meeting ended with a mutual agreement that I would focus solely on my assigned projects and raise any future concerns only through Nolan. As I left, Kira avoided eye contact entirely. The following weeks turned increasingly hostile. My access to raw trial data was restricted. I was excluded from team meetings without explanation. Colleagues grew distant, clearly warned about associating with me. Then came the final straw. I discovered our FDA submission had been approved based on the altered data. The treatment would soon reach patients, real people making life-altering decisions based on falsified effectiveness rates. That night, I made my decision. I compiled everything: the original datasets, the altered reports, the executive communications, my meeting notes. I drafted a detailed email explaining the discrepancies and their implications. After hours of hesitation, I sent it all to Eloise Winters, our largest individual shareholder and a vocal patient advocate since her father's death. The next morning, my termination email arrived before I even reached the office. Due to concerns about employee conduct and breach of confidentiality agreements, Employment is terminated effective immediately. Security will supervise personal item collection. Remove her before she talks about the trial results to anyone else. They hadn't expected me to arrive early. They certainly hadn't expected me to forward that very email to Eloise before security arrived. And now, walking away from the building with my small box of possessions, I wondered, had I just destroyed my career for nothing? Would anyone actually listen? Or would the company's narrative about a disgruntled employee prevail? My phone buzzed with a message from an unknown number. Received everything. Don't contact anyone. Wait for my call. 3 days of agonizing silence followed. 3 days of jumping at every notification, rehearsing explanations to future employers, wondering if I'd ever work in biotech again. Then the news broke. Our stock plummeted 28% in a single afternoon. Trading was temporarily halted. An emergency board meeting had been called. My phone rang. It was the unknown number. "Lorelei, it's Eloise Winters," the voice confirmed. "Can you meet me in 1 hour at Riverside Park, the bench area, by the Eastern Pathway? Come alone, and don't discuss this with anyone." My heart hammered as I agreed. Was this good news, or was I about to be threatened with legal action? I spent the hour pacing my apartment, mentally rehearsing explanations, defenses, and worst-case scenarios. Riverside Park was quiet that afternoon. I spotted Eloise immediately, a striking woman in her early 60s with silver-streaked hair, sitting ramrod straight on a bench overlooking the water. Unlike our brief encounters at company functions, she wasn't smiling today. "Thank you for meeting me," she said, gesturing for me to sit. "I've spent 3 days verifying everything you sent." I swallowed hard, and, "You were right," she said simply. "The data manipulation is undeniable. The board has hired an independent auditing firm to review all research protocols. Arthur has been suspended pending investigation, along with Nolan and the chief medical officer." Relief washed over me, followed immediately by fresh anxiety. What happens to the drug, to the patients? "The FDA has been notified. The approval process is on hold." Eloise studied my face. "You realized what this would do to patients like my father, didn't you? Giving them false hope while delaying potential treatments that might actually work?" I nodded, throat tight. My mother died waiting for effective treatments. Every week wasted on something ineffective is a death sentence for some patients. Eloise's expression softened slightly. "You sacrificed your career." "I did what anyone should do," I countered. "That's where you're wrong," she replied. "Most people would have looked away, kept their jobs, convinced themselves it wasn't their problem." The company held an emergency press release this morning announcing a thorough review of research practices. What they didn't announce is the board's vote to restructure leadership completely. My breath caught. What does that mean for me? It means you should be prepared for what's coming next. The company will attempt damage control. Arthur's allies remain in key positions. They'll try to discredit you, paint you as incompetent or vindictive. But the evidence. Evidence matters in court, Lorelei. In the court of public opinion, narrative often prevails. She wasn't wrong. By evening, industry blogs carried the story. Biotech rising star halts drug approval process amid data concerns. Comment sections already speculated about disgruntled employees and scientific disagreements being blown out of proportion. The next morning brought the company's official statement. "We take research integrity seriously and have launched a comprehensive review. While we cannot comment on personnel matters, we caution against mischaracterization of complex statistical methodologies by individuals without complete understanding of clinical research processes." The implication was clear. I was scientifically incompetent, making mountains from molehills. My phone began ringing with calls from former colleagues. Zoe, my assistant, sounded devastated. "Everyone's saying you didn't understand the exclusion criteria properly, that you misinterpreted routine adjustments." "That's not true," I insisted. "I know," she whispered. "I found something after you left. Nolan had me update the clinical protocol document, backdated to before the trial ended." My hope surged. "Zoe, that's proof of—" "I can't get involved," she cut me off. "I'm sorry, Lorelei. I have 2 kids and a mortgage. They're watching all of us now." One by one, former allies distanced themselves. My professional reputation unraveled thread by thread. Former professors suddenly couldn't recall my exceptional work. References became unavailable. LinkedIn connections quietly disappeared. Even my closest friend from graduate school, now working at another biotech firm, texted, "I believe you, but my boss says we can't have any contact. I'm so sorry." A week after my termination, the counter-narrative gained momentum. An industry publication ran an analysis questioning my statistical expertise. While never naming me directly, it referenced recent allegations and explained why apparent irregularities were actually standard practice in complex trials. The author, the chief statistician who'd supposedly reviewed my concerns, a man who'd never spoken to me directly. Eloise called again. "It's getting ugly. They've hired a crisis management firm. The evidence speaks for itself," I insisted. "Evidence doesn't speak, people do. And right now, they're speaking louder than you." She paused. "The independent audit is proceeding, but slowly. Arthur's allies are stalling, claiming patient privacy concerns require careful review procedures. My savings dwindled. Job applications disappeared into black holes of silence. One recruiter was brutally honest. "Nobody's going to touch you right now. The industry's too small." Then came the cease and desist letter from the company's legal team, citing my confidentiality agreements and threatening ruinous litigation if I spoke publicly about the company or its research. "They're trying to silence me completely," I told Eloise during our next park bench meeting. "That's not all," she replied grimly. "Arthur's been lobbying board members. The narrative is shifting to unfortunate misunderstanding and overreaction. They're suggesting a face-saving resolution where the company acknowledges minor protocol violations but frames them as inconsequential to the results." My blood ran cold. The drug would still be approved, with additional monitoring requirements. Arthur keeps emphasizing that delaying potentially life-saving treatment could cost lives. "Using the same emotional manipulation they used on me," I said bitterly. "It's working on some board members," Eloise admitted, "particularly those with significant financial stakes in similar research." The walls were closing in. I'd sacrificed everything only to watch the system protect itself. That night, I barely slept, tormented by visions of patients like my mother being fed false hope through carefully manipulated statistics. Morning brought a new blow. An email from a former mentor warning that industry contacts had heard rumors I'd been difficult and unable to accept oversight. My professional death by whisper campaign was nearly complete. I called Eloise in desperation. "They're winning." "Not yet," she replied. "The independent auditors are requesting access to server backups and cloud storage that Arthur's team claimed were accidentally overwritten. There's resistance. Why would they resist if they have nothing to hide?" "Exactly. Come to my office tomorrow. There might be another way forward." Eloise's private office occupied the top floor of a modest building downtown. Nothing like the gleaming biotech headquarters, but elegant in its understatement. Unlike our park meetings, today she wasn't alone. A woman in her 40s with piercing eyes introduced herself simply as Margot, legal counsel. "We've reviewed your situation," Margot began without preamble. "The company is methodically undermining your credibility while simultaneously burying evidence of wrongdoing." "I know," I replied miserably. "What you don't know is that 3 more board members have flipped to Arthur's side." The narrative of minor procedural oversights is gaining traction, especially when paired with emotional appeals about delaying treatment. Eloise leaned forward. "Arthur has scheduled a special board meeting for next Monday. He's confident he has enough votes to conclude the investigation with minimal findings and proceed with the FDA application." My throat tightened. "So I destroyed my career for nothing." "Not necessarily," Margot said, "but we need to consider your position carefully. The company has vastly more resources and is prepared to portray you as disgruntled, vindictive, and scientifically incompetent. A direct confrontation would likely end poorly for you. So I should just give up? Let them sell false hope to dying patients?" "No," Eloise interjected. "We adapt. Sometimes the direct approach fails where a flanking maneuver succeeds." Margot slid a folder across the table. "We've been building a different strategy, one that doesn't rely on proving the data manipulation, which they're actively obscuring, but focuses on something else entirely." I opened the folder to find meeting minutes, calendar invitations, and travel records. "I don't understand." "Keep reading," Eloise urged. As I flipped through the documents, a pattern emerged. Private meetings between Arthur and representatives from a competing pharmaceutical company. Unusual travel coinciding with offshore banking activity. Stock transactions through shell companies. This isn't about data manipulation, I realized. Arthur has been selling research secrets to competitors while simultaneously manipulating data to maintain market advantage, Eloise confirmed. The data manipulation you discovered was just one symptom of a larger disease. Can we prove this? We're close, Margot said. But we need someone who understands the research intimately, someone who can connect specific data points to specific leaks. They both looked at me expectantly. You want me to help build this case? I asked. We want you to be ready, Eloise corrected. When we present this to the board, Arthur will attempt to discredit the findings. He'll claim misinterpretation of innocent activities. We need someone who can immediately counter his technical explanations. Hope flickered, then faltered. Won't they just dismiss me as biased? Not if we present the evidence strategically, Margot explained. The whistleblower is most vulnerable when standing alone, but as part of a coordinated effort with established allies, the dynamic changes completely. For 5 straight days, I worked alongside Eloise's team, connecting dots between research milestones, Arthur's secret meetings, and competitor product announcements. The picture grew clearer. Arthur had created a lucrative side business selling proprietary research while manipulating trial data to maintain investor confidence. The day before the board meeting, we finalized our presentation. Margot seemed satisfied, but I remained skeptical. Arthur has spent weeks destroying my credibility, I reminded them. Why would the board believe me now? Because you won't be alone, Eloise said simply. Monday morning arrived with a sick feeling of dread. I hadn't slept, plagued by nightmares of public humiliation. Would this flanking maneuver work, or was I walking into another professional execution? The company's gleaming headquarters looked different now as I approached the entrance beside Eloise. Security guards did double takes, but, seeing me with a major shareholder, reluctantly allowed me through. In the elevator, Eloise squeezed my hand reassuringly. Remember, she whispered as the doors opened to the executive floor, sometimes revenge isn't about destroying your enemy. It's about restoring truth. The boardroom fell silent as I entered behind Eloise. Arthur's face contorted from confusion to rage. What is she doing here? He demanded. This person has no right. Miss Tanner is here at my request, Eloise interrupted smoothly. Before we proceed with your agenda, Arthur, I've asked for 10 minutes to present some relevant information to the board. Arthur's gaze darted nervously around the room, assessing allies and threats. This is highly irregular. We have a full agenda today. I'm sure we can spare 10 minutes, said an elderly board member I recognized as the former chief scientific officer, especially for our largest shareholder. Arthur's jaw tightened as he reluctantly nodded. 10 minutes. Eloise gestured for me to be seated as she moved to the front of the room. Before I begin, she said calmly, I'd like to introduce someone else who will be joining us. The boardroom door opened again, and my heart stopped. Zoe walked in, clutching a laptop and looking terrified but determined. Behind her came the chief statistician, Dr. Barton, whose analysis had been used to discredit me. He avoided eye contact with Arthur, whose face had drained of all color. What is the meaning of this? Arthur sputtered, half rising from his chair. Please remain seated, Eloise directed calmly. We have several matters to discuss before your proposed vote. The boardroom crackled with tension. I noticed Nolan shifting uncomfortably in his seat, while the other board members exchanged confused glances. Eloise gestured to the large display screen. 2 weeks ago, Lorelei Tanner raised concerns about data manipulation in our flagship cancer treatment trial. She was promptly terminated and subjected to what can only be described as a systematic campaign to destroy her professional credibility. Arthur cut in. We've already addressed this. The independent audit is ongoing, but preliminary findings suggest minor procedural issues That's not accurate, Dr. Barton interrupted, his voice quiet but firm, and I can no longer participate in this deception. A shocked silence fell over the room. Dr. Barton? Prompted one of the board members. The statistician straightened his shoulders. I was asked to review Miss Tanner's concerns and instructed, not asked, instructed, to find explanations that would minimize their significance. When I expressed reservations about the scale of data exclusions, I was reminded of my non-disclosure agreements and the potential impact on my career. Arthur's face had turned from white to mottled red. This is preposterous. You're speaking completely out of turn. I have the original data analysis, Dr. Barton continued, as if Arthur hadn't spoken, and the modified versions created after Miss Tanner raised concerns. The differences are not minor statistical adjustments. They fundamentally misrepresent the drug's efficacy. The temperature in the room seemed to drop 10 degrees. Board members leaned forward, expressions grave. Eloise nodded to Zoe, who connected her laptop to the display system with trembling hands. 3 days after Lorelei was terminated, Zoe explained, her voice initially shaky but growing stronger. I was instructed to modify the clinical protocol document and backdate it to before the trial concluded. The original stated that patients showing any adverse reaction would remain in the analysis. The revision changed this to exclude patients with anomalous responses not consistent with treatment protocol. She pulled up both documents side by side on the screen. This revision, she continued, was created specifically to justify removing the 57 patients Ms. Tanner identified after they had already been removed from the analysis. The board chairman, a distinguished older man who had remained silent until now, addressed Arthur directly. Is this true? Arthur's expression hardened. These are complex research methodologies being mischaracterized by junior staff with incomplete understanding. Our legal team has reviewed all protocols and found them consistent with industry standards. That's also not accurate, came a new voice from the doorway. All heads turned to see the company's legal counsel, Whitney, enter with a thick folder. The same woman who had warned me about breaching confidentiality during my final meeting with leadership. Whitney? Arthur's voice cracked slightly. What are you doing? My job, she replied simply, placing her folder on the table. The legal department did not approve these protocol changes. In fact, we specifically advised against them in writing. She slid several documents toward the board chairman. These are the contemporaneous memos detailing our concerns about retroactive amendments to research protocols. Arthur's expression shifted from shock to calculation. These presentations are clearly orchestrated to create a false narrative. The broader context. Let's discuss context. Eloise interjected smoothly, returning to the front of the room. Specifically, the context of your meetings with representatives from Meridian Pharmaceuticals over the past 18 months. The blood drained from Arthur's face again as Eloise displayed a timeline of meetings, calendar screenshots, and hotel receipts. This is a personal matter, he stammered. I have friends at many companies, including friends who pay for offshore consulting services through shell companies registered in your wife's maiden name? Eloise asked, displaying banking records. Friends who mysteriously advance their research in areas precisely aligned with our proprietary developments? The boardroom erupted in shocked murmurs. This is absurd, Arthur declared, but his voice lacked conviction. You're connecting unrelated events to create conspiracy theories. Dr. Barton cleared his throat. There's more. He tapped on his tablet, and the screen displayed a technical comparison of molecular structures. This is our proprietary compound from Phase 2 trials last year. This, he said, highlighting another structure, is Meridian's breakthrough, announced 3 months later. The similarities cannot be coincidental. For the next 20 minutes, the evidence mounted. Precise correlations between Arthur's undisclosed meetings and Meridian's research advancements. Data manipulation, time to maintain investor confidence, despite research leaks. Nolan's role in pressuring research staff. The systematic effort to discredit me after I raised concerns. Arthur's initial bluster gave way to tight-lipped silence. Beside him, Nolan stared fixedly at the table, occasionally shaking his head slightly as though unable to believe what was happening. Finally, the board chairman turned to me. Miss Tanner, you were at the center of this. What exactly did you discover that prompted your termination? I took a deep breath, feeling the weight of every eye in the room. I identified 57 patients removed from the final analysis without proper justification. When included, these patients reveal our treatment performs only marginally better than existing options, not the breakthrough we've claimed publicly. After raising concerns through proper channels, I discovered communications explicitly directing staff to manipulate data for investor presentations. And you have evidence of these communications? Yes, I confirmed, nodding to Zoe, who displayed the message thread I'd discovered on the improperly secured shared drive. There it was in black and white. Needs stronger efficacy numbers, followed by, will remove outliers. The chairman's expression hardened. Arthur, do you deny writing these messages? Arthur's lawyer, who had slipped in during the presentation, leaned over to whisper urgently in his ear. After a moment, Arthur sat straighter. On advice of counsel, I have no comment at this time. I believe that's comment enough, the chairman replied grimly. He turned to address the entire board. I move that we immediately suspend Arthur Reeves from all duties pending full investigation, notify the FDA of potential research irregularities, and withdraw our current application for BX 273 approval. Seconded, said Eloise immediately. All in favor? Every hand except Arthur's and Nolan's rose in unison. The motion carries, the chairman announced. Arthur, please surrender your access credentials to security and vacate the premises immediately. The board will convene an emergency executive session following your departure. As Arthur rose shakily to his feet, his gaze locked with mine, for a moment, I saw a complex mixture of emotions, rage, disbelief, and something that might have been grudging respect before he turned away. This isn't over, he muttered as he gathered his belongings. Actually, Eloise said quietly, it is. The SEC has been notified about the insider trading implications, and the FBI is investigating the corporate espionage aspects. Your legal challenges will be significant. After Arthur and Nolan were escorted out, the chairman turned to me. Miss Tanner, on behalf of the board, I extend our sincere apologies for your treatment. The vindictive campaign against your professional reputation was unconscionable. I nodded, emotional relief washing through me. Thank you. But my primary concern has always been the patients. What happens now with the treatment? We'll conduct a complete, transparent reassessment, he assured me. If BX 273 offers even modest improvements for some patient populations, it may still have value, but marketed honestly, with appropriate expectations. Eloise cleared her throat. There's one more matter to address. As our company rebuilds from this crisis, we need leadership committed to research integrity above all else. The board's executive session will consider creating a new division of research integrity that reports directly to the board, not to the executive team. Her gaze fixed meaningfully on me. We'll need someone with uncompromising ethics and the courage to stand alone when principles demand it. 3 weeks later, I walked through the company's front doors, no longer as an escorted ex-employee, but as the newly appointed Director of Research Integrity. The changes had been swift and comprehensive. Arthur and Nolan faced federal charges for securities fraud and corporate espionage. The chief medical officer had resigned. An external review team was meticulously re-examining every research protocol. As I rode the elevator to my new office, ironically, Arthur's former space, I thought about the past month's whirlwind. The press coverage had transformed from subtle character assassination to highlighting corporate malfeasance. My professional reputation had not just recovered but strengthened, with industry publications featuring interviews about research ethics. My new team included Dr. Barton, who had found his ethical compass when it mattered most, and Zoe, promoted to deputy director for her courage in coming forward. Even Whitney from legal had requested a transfer to our division, telling me privately, I want to be on the right side this time. The most meaningful development came yesterday. Preliminary reassessment indicated BX 273 showed significant benefits for a specific genetic subset of patients, about 30% of cases. For those patients, it might indeed be life-changing, though not the universal breakthrough originally claimed. A more focused, honest application to the FDA was already in progress. As I settled behind my desk, Gina from HR appeared in my doorway looking profoundly uncomfortable. Lorelei, she began hesitantly. I've been asked to coordinate the announcements about leadership changes. I remembered vividly her false sympathy when announcing my personal decision to leave. I'm sure you'll handle it professionally, I replied evenly. She shifted nervously. The thing is, I wanted to apologize for my role in what happened. I was just following orders, but that's no excuse. I studied her for a long moment. You're right, it's not an excuse. I let the silence stretch until she began to turn away. But it is a starting point. We're rebuilding this company's ethical foundation, Gina. Everyone deserves the chance to be part of that. The relief on her face was palpable. Thank you. I won't let you down. After she left, I opened my desk drawer and placed my mother's photograph in its place of honor. We did it, I whispered to her image. Not just justice, but something better. Change. My phone buzzed with a message from Eloise. Board-approved expanded research integrity budget. Full authority to implement new protocols. Proud of you. I smiled, glancing out at the research campus below my window. Revenge hadn't come through destroying Arthur, satisfying as his downfall might be. The true victory was in transforming the system that enabled him. Every patient who would now receive honest information about treatments, every researcher who could work with integrity, every future whistleblower who might find support instead of persecution. That was the real revenge against everything Arthur represented. I opened my laptop to begin drafting the division's new operating principles. The first line came easily. Truth serves patients better than comfortable fictions. If you've ever faced an ethical dilemma at work or wondered whether speaking up is worth the risk, I hope my story offers some inspiration. The road isn't easy, but integrity matters, especially when lives are at stake. Please share your thoughts in the comments below, and if this story resonated with you, hit that like button and subscribe for more real workplace experiences. Remember, sometimes the most important voice in the room is the one willing to stand alone for what's right. Thank you for listening to my journey.